Hi, my name is Dr. Andrea Renee, and I'm a licensed acupuncturist in the state of California, and I'm a doctor of acupuncture and Chinese medicine. And I've been invited to talk to you today about PTSD, post-traumatic stress disorder, because I myself was diagnosed with PTSD in 2007, and it's also one of the specializations that I treat in my clinic. Some of the symptoms of PTSD are anxiety, depression, insomnia, also pain. So I treat a lot of pain and a lot of anxiety, depression, insomnia, post-traumatic stress disorder symptoms, and patients that have been diagnosed with post-traumatic stress disorder because acupuncture has been shown to be equally as effective as cognitive behavioral talk therapy and pharmaceutical psychotropic medications. So I used acupuncture and traditional Chinese medicine to heal myself from my own PTSD diagnosis that occurred after I had a car accident. One of the obstacles that get in the way of patients being diagnosed and seeking treatment is just realizing what's going on, because it is absolutely normal when we experience a stressful event, a life-threatening event or a perceived life-threatening event, to have a stress response. To go into fight or flight is completely normal. The difference with PTSD is that we stay stuck in that post-traumatic stress disorder stress response. So we stay in fight or flight for over a month in order to receive a post-traumatic stress disorder diagnosis. The other thing that can happen is that even if we're not stuck in that state constantly of anxiety, panic attacks, depression, moodiness, and also avoidance behaviors, attempting to avoid, we can attempt to avoid the triggers that create the stress response returning if it is able to leave. So that's one of the things to notice, is what is going on. After a stressful event, are you avoiding certain behaviors? Like I would avoid having to walk in Manhattan, cross the street at crosswalks. I would avoid taking taxi cabs because those were triggers for me that would reignite my stress response symptoms. So the bottom line is to first realize that your symptoms are normal and that there is treatment. And you can do a combination of talk therapy, psychotropic medication, and acupuncture. You can also just do acupuncture alone. Studies in the Pentagon have actually shown that soldiers prefer the acupuncture treatments over the talk therapy because it's not necessary to revisit any traumatic events. You don't have to revisit experiencing them by talking about them. The acupuncture treatment will actually reset our nervous system out of fight or flight and retrain our nervous system to stop going there automatically when there is no stressful event. So it is possible to get a faster, more effective treatment with less trauma of re-experiencing events through talk therapy with acupuncture. And that is what I had personally found with my experience. And that's what I have been able to see with patients that I've treated. So the results of an acupuncture treatment can even last as long as 3 months. So it's about realizing that we are in a state of PTSD because our symptoms are not leaving for over a month, and then realizing we have choices regarding our treatment. And then we can overcome the obstacles of not knowing what was going on. I really didn't realize what was going on. I thought it would just go away by itself. And then I realized after 9 months of chronic insomnia and panic attacks that it wasn't going to go away. These symptoms I had after the car accident were not going to resolve on their own. So I encourage you to realize that there is help if you are experiencing these symptoms for more than a month. And the treatment doesn't have to be invasive or re-triggering any trauma for you if you choose a therapy such as acupuncture. Thank you very much for your time today.